Good evening, everyone, and welcome to our Family Medicine Residency Virtual Showcase tonight. We are going to hear about women in medicine and about the UPMC Altoona Family Physicians Program. And I am Scott Allen. I am the CEO for the Family Medicine Education Consortium. So just going to give you a couple of quick minutes about the FMEC and then turn it over to our team at UPMC Altoona. So if you don't know who we are a regional coalition focused on academic family medicine. We cover 14 states and the District of Columbia. That's got about 60 medical schools in the region and about 200 or so family medicine residency training programs. Our big event is an annual meeting that we do each fall, and I'll mention when that is in a moment. It brings together almost 1,000 people, about a third medical students that we bring on scholarships to learn about family medicine and to meet with the residency programs. Another third or so are residents, and another third or so are faculty. We also do a series of awards, which you can find more information on our website. We do learning collaboratives around different topics. Right now we have hereditary breast cancer and narrative medicine. We have integrative medicine. And we also have a lot of ways you can get involved with us to help plan the meeting or participate in those learning collaboratives. So I hope you will follow up and learn more about the FMEC. We are a catalyst and a convener and an incubator, and really our goals are to bring all these residency training programs and medical students together across the region and help them learn from each other, help them collaborate, and just do a lot of really great work. So if you are not already planning to come to our annual meeting this October, please join us. We are in Rhode Island in Providence, October 13th through the 15th. It should be an exciting meeting. And then next year we are in Philadelphia, September 19th through the 21st at the Philadelphia Marriott right downtown. So that should be also a really fun meeting. And with that, I am going to stop sharing my slides and turn it over to Dr. Sweeney.
Thank you, Scott, so much. I hope all of you will get to go to Family Medicine Educational Consortium. It's a really an energizing experience that I always enjoy, and we've gone for years. And we will be there, UPMC Altoona. So welcome. And I guess the first thing I want to do is let the students, I see Neola. Are there other students? I didn't go through my gallery. I have to kind of get a view so I can see everybody.
Yeah, there's a bunch.
Yeah, I think I will have to. Scott, how can I get the gallery view so I can see everybody? Oh, I think if I hit gallery, it'll do it. That was really brilliant.
Okay,
I'm sure. I catch on so quick. I hit gallery. Not that I didn't like seeing Scott like filling my screen, but this is better. So hi, everybody. I noticed we have some little ones. We have Jakey on with Megan, and we have Sean with Mina. We're going to try to really make this fun tonight. I'm Kathleen Sweeney. I'm one of the associate directors of the family medicine residency at Altoona Hospital. Oh, we're UPMC Altoona Family Physicians. Sorry, had a little 10-year cognitive issue, UPMC Altoona. And I'm very happy tonight to be here with my faculty, my residents, and my program director. A little bit about our program is we're located in central Pennsylvania. We're about 3 hours from DC, three and a half or 3 3/4 from Philly, about 2.5 from Pittsburgh, but it's all depending on whether you drive like me or Dr. Beckstead. With Dr. Beckstead, you can make the time shorter. With me, make them longer. We have a nice, very safe community that's in the mountains with beautiful hiking and boating and skiing, and we all really enjoy it. Our residency is full scope. We do everything from the ICU to deliver babies, and some of my faculty deliver babies, like Dr. Katoya here with me tonight, and she can share about that. We have lifestyle medicine. My faculty, Dr. Megan Maurer, who heads that, is here. And we have a very, very good osteopathic recognition program. Our OMT curriculum's really, really very practical and very helpful, and I take care of that. Dr. B, what else should I say about the residency? I'm going to introduce you, and maybe you'll add a little. Dr. Beckstead's our program director, and today they were like, the residents were making comments about different faculty, and I was really tickled that they said that Dr. Beckstead was a cool dude and he'd help you out with anything. So it's something like that, and I thought that's cool. But Dr. B, what would you like to share?
First of all, welcome everybody. Don Beckstead, like she said, I'm program director. I've been a program director for a long while. Cool dude, I don't know. I'm kind of old to be a cool dude.
I thought you were.
Heck,
you're cool.
President said it, not me, so I'm all right with that, I guess. No, I just wanted to pop in. I don't want to steal the thunder from Dr. Sweeney here, but I kind of feel like we've always had a very resident friendly and family friendly residency, which it should be. If you're doing family medicine, you better be family friendly anyway, you know. So I just thought that I'd kind of emphasize we've been that way long before ACGME had any rules about it or anything like that. We've always been able to be very flexible with our curriculum, flexible with our rotations, flexible with pregnancy leaves and stuff like that, such that we've been able to get everybody kind of accommodated, taken care of, happy, being able to see their children and still get through the residency, hopefully on time. Pretty much everybody's been able to do that. Going forward, we have a new lactation room. We have lots of new and better equipment that we have in the office. And I think it's just a good place to do residency in general. So that's my quick summary.
Yeah, Dr. B, if you have to run, I'm going to ask you the thing I really think you've done so well over the years. If you could comment, you know, you've had women faculty and men faculty that have had family issues. You've had residents that have had all kinds of issues, whether it's a death in the family or, you know, someone adopting a child or having a child. What's been you've been successful at it. What's the secret to your approach?
Oh, I think it just all goes back to wellness. I mean, it's again something we've done well long before there were any requirements for it. We just kind of believe that everybody should be taken care of. You know, your job is your job. And sometimes it can be difficult, sure, but it doesn't have to be, you know, family ruining or relationship ruining or anything like that. So we always have had this kind of, if you're really tired, we'll give you a break. If you need a mental health day, you get a mental health day. If you've got some family issues, we'll get you taken care of. You can almost always adjust electives and stuff like that and adjust rotations around to make things happen. And we, you know, because we're the only program in town, we've always been very flexible with the schedule, and there's nobody overseeing that from above us. So it makes for some resident friendly work, and I think that's really important. And a lot of programs kind of preach that. We had an interesting, we were doing our website update today. We were doing some recruitment videos, and one of our faculty who's not on the call tonight had mentioned that the residents were doing some quick, you know, kind of on the spot, just kind of citations about what the program was like. And a couple of the residents said that they were surprised by the amount of wellness that's in our program. They said, you know, everybody says it, but I was really surprised at how you guys actually put it into practice. And that's been our philosophy for a long time.
Yeah, I was real pleased with that too. It's nice to know that that's the thing they're noticing about the program. And I know that's really important to students. Well, I think what we'll do now is kind of go around the room, and I will have my faculty introduce themselves, maybe say what you're passionate about or what one of your prime responsibilities at AFP is, and maybe something a little personal or fun about a hobby or something like that. Maybe Dr. Katoy, do you think I'm going to do the gallery thing? And I know you all aren't seeing what I'm seeing, so I apologize. Dr. Katoy, do you mind going first?
Not at all. So I'm Amanda Katoy. I'm one of the faculty at AFP. I've been at AFP. I think this is my 7th year back as faculty. So I did my residency through AFP as well. I do full spectrum family medicine, including prenatal care and obstetrics. So that's a lot of fun, and I enjoy that. I really like women's health and facts about me. I like to travel, and I have a cat that's currently staring at me mad that I'm not playing with her. And I'm also expecting my first child in December. So that's exciting.
Yes, which we're all super excited about. Very, very fun. Well, that's wonderful. Thank you, Amanda. Dr. Maurer, you're next up. If you don't mind, just tell us a little bit about your role at AFP and some of the cool things you do.
Hi, so I'm Megan Maurer, and this is Felix, my son. He just decided to come join me. He's my third of 4 kids. So I have been faculty with AFP for, I think this is my 6th year, 7th year. I can't remember exactly, but I did my residency at AFP and just couldn't stay away. So I came back. I was a community preceptor for a long time too. And I I guess I'm our osteopathic director out at our rural site. And I also am in charge of our lifestyle medicine curriculum. And I also do our obesity medicine didactic curriculum. And I'm a mom of 4. My oldest is almost 9 and my youngest is 3. And as far as fun facts about me, I get to make a lot of birthday cakes. And so I really like to decorate cakes and do a lot of baking. I like to make pretty epic birthday cakes. So
you don't understand what she's talking about. When it's a birthday cake, these things are works of art. If you follow Dr. Maurer on Instagram, there's the Moana cake. There's there's cakes that have like real looks like water and surfers. I mean, they're just unbelievable.
Yeah, my favorite thing actually is to make gum paste flowers. Those are my favorite things to do. So
yeah. Well,
but
we
you can ask Felix here. He's had what, a Blaze and the Monster Machines cake, and he's had a fire truck cake and all kinds of fun things. So
yeah, and Dr. Maurer does an amazing job with our lifestyle medicine curriculum, has an obesity clinic. So she really is added so much to the program. I think our next faculty up is Dr. Devan. Can you tell us a little bit about yourself?
I'm Victoria Devan. I am also a grad of AFP. And then I went to the town I was living in and practiced for 17 years. So did office, did hospital, had a nursing home practice, was in a home-based model for a while, and then came back 3 years ago to AFP at the behest of my colleague. Fee can be persuasive. My husband was thrilled too. So my academic interests, quality, I do also some work on implicit bias with our biobehavioral faculty. We do work in diabetes as well, and have a lot of background in geriatrics and chronic disease, quality, population-based health. So I do some of those things with the residency. This is my dog, Sam. Sam, you want to say hi and stop licking? Yeah, there you go. It's his birthday today, so he's 5. So happy birthday, bud. And interest outside of, I have 4 kids, 2 stepsons who are grown, 3 grandsons. We just sent our youngest off, launched her to college 2 weeks ago, and I'm currently interested in native plant gardening, pollinator gardening, ripping lots of stuff out and hiking.
Yes, and if you notice a theme there, you can leave AFP, but you will come back. It's really funny, but yeah, you can't go away for long. You have to come back. Everybody misses AFP. I think now, do I have any other faculty on the call? And I'm going to look for my residents. Megan is one of our first-year residents, and she has Jakey with her. And Megan, can you introduce yourself and tell us a little bit about yourself and just anything you want to mention about AFP, and then we'll get to the women in medicine part.
Hi, like Dr. Sweeney said, I'm Megan Thompson. I'm from about 4 hours away from Altoona in Ohio. I came from a really rural background, and that's where my heart is. So I was glad to go someplace that also really cares about rural medicine. The most interesting thing about me is probably Jakey. He is a character. He told me he was going to tell you all his name is Dada, because his favorite thing to do is answer questions inappropriately and call them jokes. So toddler humor is very fun. And I am also expecting a baby in February. But I really like AFP because not many places will tell you we hate families, we're not family friendly. So I did an audition rotation, and when the rubber meets the road, that's really what they mean. So that's one of the things that really attracted me there. And I figure even if another baby wasn't in our future, that if they cared enough about people who were expecting families, whether that's men or women, and that was someplace that really cared about the whole person.
Well, thank you, Megan. It's really something we value and try to show rather than tell. So that's wonderful. I have another guest a former resident who's now our palliative fellow, and that's Dr. Mina Gella. Mina, I see Sean's been with you too, her little boy. Can you tell them a little bit about yourself and your relationship to AFP?
Sure. My name's Mina. I am currently the Hospice and Palliative Medicine Fellow I'm a recent graduate, so just graduated in June of 2023, so still hard to believe. I also did the lifestyle medicine curriculum with Dr. Maurer, and I really like OMT, so spent a lot of time with Dr. Sweeney. My son is a residency baby. I was pregnant during my second year of residency with COVID and everything, but everyone was so supportive, and actually had to have him 20 days early, and the residents really band together and did my inbox and different things like that. So I really do mean it when I say that AFP is family friendly. I was not even the first resident that was pregnant in the same year. There were 3 of them. So there were 3, it was like 6 months apart, 6 months apart, 6 months apart. I was the third in that cycle. And then after me came Aubrey, one of my close friends and the head of women's health, who married a graduate of the program, who was in the program when their daughter came 6 months after my son. So that ended that cycle, and we're starting a new cycle. So it kind of comes in waves here. So we're very family friendly. We actually take a traditional picture every time Nora, Aubrey, and I are together with the 3 kids, because they're literally almost exactly 6 months apart. So very family friendly. As I am now the hospice and palliative fellow, I have a little more free time. So I'm trying to learn some new hobbies. I like reading right now, spending some time outside, which I did not do much just because of personal preference during residency. So you're trying to get some new hobbies in there, but I'm happy to answer any questions about what it's like to be pregnant in residency and what it's like having a newborn in residency and things like that.
Yeah, that was so much fun when all of you were pregnant. And then we went to Nora's wedding, and we had a nursing room, and we had like 4 AFP babies there. And it was funny because I think either Dr. Rule or said to me, or Dr. Beck said, somebody said, well, did they cry? I go, AFP babies don't cry. You know, we keep them happy and fed. They don't even cry. So, but then they didn't at that wedding. You can vouch for that, right, Mina? They were all happy.
I can. Yeah, and I also want to throw out there that I wasn't going to breastfeed because it sounded so scary. And Dr. Kathy Sweeney up there is the one that talked me off the ledge and got me started on it. So very, very family friendly. And my son actually was delivered by a co-resident, and the pregnancy was managed by a co-resident and Dr. Seams, and they still see him in the outpatient right now. So it's pretty cool.
Well, thank you, Mina. I appreciate you taking the time, especially after a busy palliative clinic today. Now, who else of my residents do I have? Anybody else? Because I'm not so good at gallery. Am I missing anybody? If not, we're going to get into the hard questions, and everybody be ready. The first question I'm going to do for Dr. Maurer, because she really has some good insights into this. You know, imposter syndrome, Megan, you've talked to us before about this. How is it stressful for women doctors? How can it influence them? And how would you advise a young person that might be feeling a little like I'm not up to what I'm supposed to be?
Oh, geez, hitting me with the hard questions right off the bat. My son's coming back. I have to tell him to be quiet so he's not piping in. So I think women physicians do tend to struggle with imposter syndrome, probably a lot more. And I don't know, maybe that's because we're kind of, I don't know, constantly struggling to prove ourselves more in a career that's traditionally like, I don't know, man's world or whatever you want to say. But I feel like if one of the things I really liked about being at AFP actually is it was such a nurturing environment that kind of helped me with my imposter syndrome. It was kind of a place that I kind of felt like I could, you know, grow and be in a place that was really supportive. I'm not going to lie, I still have times where, you know, I get up and I do didactics and people look at me and think I'm like an expert about stuff, and I still think like, really? You know? So I'm still kind of getting used to that, because I mean, you know, I have actually 3 board certifications at this point between lifestyle medicine and obesity medicine and family medicine. And so I don't know, it's something I still do struggle with from time to time. And I think just over time, as you spend more time practicing medicine, it gets a little bit better. But I think one of the best things you can do is just acknowledge that it's there. And acknowledge that a lot of us go through it, and that it's a common experience, and that even as attendings, we still sometimes have it. And I think it's important to, I don't know, like I said, acknowledge it and say, yeah, it's still there, but it's kind of a normal experience to have. And it does get better as you learn more. And that in some ways, it's not necessarily a bad thing, because I don't know, it makes me keep learning. I still check on things. I still make sure to read all the time, because I want to make sure that I know what I'm doing. I think it's almost scarier to think you know everything and not ever look anything up. So, but I guess one reassurance I can at least give to medical students or anybody else who's feeling it is that it's a pretty normal feeling, I think, that a lot of us have. And that, you're not alone. Even some of us as attending still feel that way. So.
Yeah, I know in my last grand rounds, remember I put up that one picture where I made those circles, and the one circle was what we think we know. And then we think everybody else has a much bigger circle. But then in the slide, I showed them the small circles that you know as much as the other folks. And you just have to stay working at it and not do comparison, because we do an awful lot of comparison. We don't know what other people are thinking or what they know, but we do too much comparing, and just kind of just keep at it. And of course, we try to be supportive of each other. So that's great. I'm going to ask a question. I'm not sure which faculty or Mina or would like to answer this, but some people feel that there's barriers for women, and Dr. B might even weigh in academic medicine. What barriers have you seen, and in what ways has either our program been able to support you or helped you move through those? And I will comment on this in that I think Dr. Beckstead has helped me move through many of those barriers, and the way he does it, and I think Megan would agree with me, and Amanda would agree with me, and Vic would, is he's very supportive. He lets you run with things, and he really values those people he works with and makes you feel more confident than maybe you feel yourself. And I think that kind of environment, without micromanagement, really helps anybody help move forward in academic medicine. But he's always looking for opportunities to help us either go to a conference or to learn something, or if we want to pursue an academic paper, any of those things. So I think that's just something that I wanted to think about. Does anybody else have any comments on barriers for women in academic medicine?
I think I've seen a lot of it over the years. There's a lot of, depending on the organization, there's a lot of, traditionally male roles, especially like in director roles and stuff like that. But our program, before I was program director, we for 10 years had a female program director. And for that matter, the only reason that I took over for her is that she wanted to leave to do something on a national level that she couldn't do when she was our program director. She actually became the head of the Program Director Association for the whole country. And then our administration said, well, you really can't do both. So she left. And then I kind of defaulted into the spot. But, we've certainly been, female friendly for a long, long, long time too, not just family friendly. But I've seen a lot of other organizations where that's not the case, where you see the program directors and the chairs of family medicine and stuff like that have been traditionally male roles, from way back into the 70s and 80s. And I, by being an old person, I've had the chance to see that kind of history. But it's really changing a lot now. I think a lot of those organizations have changed. Fortunately, we really have not had to deal with that in Altoona at all. We've always had it. Half our faculty's been female. More than half our residents are female. So I think it's never been an issue for us. As far as those supporting you guys, I mean, you're so much better than I am at so many of these things. It's really easy to be supportive. It's like, well, go with it. I'm not going to do it. So I appreciate it.
Now I'm going to open it to the students. Oh, Vic, did you want to comment?
Yeah,
Go ahead.
I was actually, one of the things that, I was in practice for a long time, and now I'm in academic medicine. And so part of it was, and Don and I would talk about this. I'm like, I gotta figure out where I fit in. And he's like, here's some of your histories, but kind of go with things if you're interested. And part of it for me was finding kind of gaps. And there were certain things you guys wanted me to, to kind of focus on. But I think one of the things about academic medicine that makes a place more whole person friendly is that scholarly activity in academics is not just certain kinds of publications. There are a lot of things that are scholarly and are important to advance family medicine. And I think it's been a nice balance. We've got folks who've had, you know, have had publications, but we also do curriculum development. We also change that curriculum. We give presentations. And so I think that in academic medicine, there's a lot of flexibility in that, for you to kind of lean into your strengths and work on other things if you have an environment that doesn't think that this is what scholarly academic medicine is. It's this narrow picture and everybody has to put out this kind of scholarly work. And so I think that's been one of the things, is that there's so much more out there that we do that's important and counts as that kind of work. That's not just a publication in a paper in a journal. And this kind of thing I think is really important for I think people to realize, and if they're interested in academic medicine, asking questions beyond the publications. It's not a university, it is clinical training, and a lot of what we do is a little different.
Yeah, well, thank you. Now I want to get my young attendees on, and I'm going to make a statement, and I'm really interested to hear how Megan and Mina will contrast this with maybe Amanda and Megan and Vic. So we're going to have the young people, Mina and Megan first. And here's what I was thinking about. You know, is balancing work and home really possible, or is it really just a matter of readjusting priorities constantly? So I'm going to just throw that out. I'll let maybe Megan go first. What do you think? You're just in your first year. How are you think balancing is possible, or do you think it's a constant readjustment?
Well, I wouldn't say that those concepts are mutually exclusive. Sorry if I'm going to ruin your question right from the beginning. Hey, be gentle. I'll read your book after I'm done talking. So because like when you're balancing, even on one foot, if we're going to go with a physical level, you don't constantly, like your muscles aren't equally engaged. You start leaning a little too far one way, leaning a little too far in your family, and then your inbox my inbox has already started getting crowded, and then you lean a little bit too far. Like, let's prep that presentation 3 months in advance, just in case. And then your child throws a book at you because you weren't paying attention to them. So I think it's a lot of constant readjustment. And it's also good to have people who will really tell you how it is. So whether that's your spouse or your sister or friend or your mom, because sometimes with an outside perspective, they can see ways that you're veering too far off course in ways that you can't. Or sometimes you might just naturally have a bias and feel like you want to spend more time at work than maybe you should, or you naturally want to spend more time with your family and neglect some of your other responsibilities. So I think having supportive community around you who can give you that honest opinion really helps maintain the balance.
That's a great insight, Megan. I love that. That's why I just threw it out. I'm curious to say, what do you think, Mina? Are you balancing or like readjusting? What's your insights?
So I think, like, looking back at residency, so my first year I didn't have a kid. So I spent a lot of time at work because I was very much like, you know, this is the last 3 years that I'm going to be trained with so much supervision and I need to take advantage of it. So I definitely balanced the way where I fell at home and was constantly balanced at work a lot my first year. Through my second year, I was pregnant, and I had to balance the limitations of what I wanted to do and what I physically could do. We talked about this a couple times, Dr. Sweeney, where I love OMT, but it got to the point where I could not lift a 400-pound man's leg because I was too pregnant for it. So I had to find a way to balance how much OMT I could do and, you know, my own physical boundaries. And then as I became a mom, and Dr. Maurer definitely set me straight a couple times where I would, you know, be like, I have to get all my notes in. And she'd be like, you also have to, you know, take care of yourself and get out of the door before 6 o'clock and go home and, you know, be a mom and be part of your family and not get engorged and all the fun things that come with parenting. So I definitely appreciated all the mentors that I found along the way that helped me keep that balance. Sometimes it's hard to find that balance. So I'm one of those people that has to have all my notes done and my inbox completely cleared and, you know, all those OCD things where I need everything done right away. And I think a lot of my mentors, like Dr. Seams, was there every step of the way to be like, you just worked a 24-hour call. Your inbox is not going to be cleared. Cut it out and go home. So I think when I had issues with the balance, I always had someone there to push me back to a neutral when I would kind of lean that way and default that way. So, and I think each rotation finds a new balance. So inpatient is very hard to find that balance just because of the time you spend in the hospital and the time you get all your work done, but by the time you're home, you have to give up, you know, that extra long shower to help your husband fold the laundry and not lose his mind balancing everything at home. So I think the balance constantly recalibrates per rotation that you end up on, and the people that are around you, especially AFP, constantly help you find that balance, which is something I've really appreciated over the last couple of years.
Well, thank you. I'm hoping this is helping our students online. I can pause here, and I'm going to ask my other faculty to comment on how they balance, because Dr. Devan's done it in private practice. Dr. Mauer's done it in different circumstances. She worked in urgent care, and Dr. Gatoy's done private practice. Why don't we go with the faculty telling a little bit about their experiences in different times in their careers in private practice, perhaps? That might be of interest. Amanda, could you speak to that a little, and Dick?
Sure. I will say that I probably have a little less balancing to do as the currently childless female on here from AFP. And that was reflected in my time in private practice. You know, I was fresh out of residency. I was single at that point. But I will say that in a situation like that, I actually found it easier to balance in private practice because I sort of had set hours. You know, I worked 8 to 5. I saw my number of patients. When I finished my notes, I went home, and then that was my home time. So being within academic medicine, having more, you know, after hours responsibilities with supervising residents, with being involved on the OB floor and hospital medicine, it does get to be a challenge sometimes. And I think something that we all are very aware of, but also need to remind ourselves of, is that, you know, we're only given 24 hours in a day, and we're not superhuman, and we can't stretch that, and we can't go back in time and redo things. But we need to figure out how to maximize what we're able to do in those 24 hours. And to echo kind of what Mina and Megan have said, is that you know, it's not always going to be a perfect balance, work and home. You know, you're going to recalibrate on a daily basis, on a weekly basis, where sometimes things are going to be a little more intensive at home. And you're going to need to put a little more of your focus there. And you're not going to neglect your work, but perhaps you're not going to put, you know, the extra hour in at the end of the day, finishing your notes before you go home that day. Conversely, sometimes there are days where, you know, work is my main focus. If I am on OB call and we have a patient there, I may be at work for 25 hours straight, and my husband knows that, and he knows to make accommodations for that when that happens. So it's not always going to be one way or the other, and it's just kind of a matter of figuring out, you know, what that balance is on any given day, as opposed to, you know, trying to really push. I'm constantly 50-50 work and home.
Well, that's a wonderfully insightful answer, Dr. Kachoy. I think one thing it brought to mind is someone once told me is, you are a pie, and you can cut that pie whatever way you want. You can make the slices any size you want. You can have a sliver, you can have half a pie, but you ain't getting more pie. So when you're trying to figure out what you're doing, you have one pie, and you're going to have to slice it in the way that takes care of, you know, the needs of your family, your home, your work. But you can't not feed both portions, or if either portion gets hungry, it's going to be a problem. So let's move on to Dr. Devan. And then students, think a little bit, because very soon I'm going to have us be quiet. I was giving you an idea of what we're all like. We're very friendly like, and you can ask us anything you'd like. Dr. Devan, What do you think? You know, you were in private practice, you had little children at the time. Tell us about it.
He was very busy. I think you know, my husband was really good. You know, there's you know, we talk about imposter syndrome as physicians. I think also we can have imposter syndrome as parents. You know, like this is how it's supposed to be. And in reality, it's usually a little more unpredictable, a little more chaotic. And just, you know, even if you have, you know, pets, house, whatever, there are things in life that kind of get you off of this. Here's the schedule you want, and here's, you know, some of your day. So I think one of the things that was important for me was, and you know, everyone else has talked about this, is the day doesn't always go exactly the way you expect, or the week, but there's a rhythm to things. But sometimes you also have to decide what's really important to spend time on. And like, you know, my mother used to say, the dishes aren't going anywhere. And my husband's like, you know, you don't really have to do that. You can just relax. It's okay. You know, it's not, whatever's not going anywhere. So I think for me, sometimes it was, you know, today was really good enough. Some days you're like feeling like a rock star, and some days you're like, okay, it's time for a nap, right? But I think acknowledging that the balance is very time dependent. So there are certain times when both my daughters were younger, my FTEs were cut back. I cut my FTEs back a little bit, so I had a little bit of breathing room on how that worked, and I was able to do that where I was before. And then it would step up a bit, which was nice. And I tried to be strategic, like for the kids. I tried to be strategic about. I would look at the schedules at the school district schedules in advance and pick a few days to take off just because they were going to be off school on whatever. But you can do it, and it's fun. And, you know, it's nice to go to work that you like. It's nice to have a work day that you love and a kind of job that you find wonderful and meaningful. And then you go home and you have other things that you can do too. But it's also good to forgive yourself for not, you know, feeling like, okay, I have to be like this all the time. You don't.
Yeah, I think
and everybody else is going through the same stuff. All your doctor partners, all your parent partners, everybody is going through a lot of that too. Medicine can be very demanding, but it's also terrific. And, you know, we have, you know, kids who are thinking about medicine or already doing something along those lines because they saw that being done and thought that was cool too. So
yeah, I think that the one thing that really resonated for me that you said, Dr. Devan, is that good enough. I always try to tell the young residents when they have children and stuff, you only got to be good enough. It doesn't have to be perfect, is not attainable nor desirable.
Occasionally there was a Friday. It's like the kids are fed, there's still toilet paper in the house. We're good. You know, get some sleep.
If you brushed your teeth, you brushed your teeth before you went to work, it's a good day.
Yep. And that's okay sometimes, because life is not perfect and we don't have to be perfect.
Right. Now, any of the students, and I don't want to put you on the spot, but if you want to unmute and ask any, you can say a faculty question, a resident question, anything you'd like to know.
Hi, my name is Lydia. I am sorry I joined the call a little late. I got home from work a little late. But I have a question specifically like for residents, but also for attendings, but I'm more interested right now in residents. It's related to burnout because I understand that is a very common theme, especially like in residency. And I was wondering, like, what kind of skills do you use, or what specifically do you rely on to keep that motivation? Like, what have you found that works for you?
With my hefty 2 months of residency experience so far, but I think we can agree as you get into clinical years that you can still get burnout. You don't have to be a resident to get burnout. Yeah. If you're feeling any way like that. I would say self-awareness is the biggest skill that I could encourage someone to develop, is kind of having a good sense of yourself and knowing when you're getting too far, when you're moving from tired, it's been a hard day, to I always feel this way, I don't want to go into work. So knowing when you're reaching that point and having people around you that maybe can tell you when you're extra irritable or, what's wrong or however you typically get. And something that has been helpful for me is knowing what coping strategies I lean towards, which is sweets. When I start to really not feel good, I start reaching for the chocolate chips in the top of the cabinet. And I'm not going to tell you that chocolate chips are the worst thing ever. But if I'm trying to cope with like my circumstances and my feelings with food, that's not going to help. And it's going to have other consequences. And if I'm feeling burnout, I already don't have time to go shop for new pants anyway. But also knowing what things like are helpful for you. So exercise has always been really helpful for me. So even when I don't feel like doing it, making a point to do it, even if I don't feel that great after, I know that having that regular routine is something that I can depend on. But I would really say self-awareness and developing a group of community. That's also important when you're selecting residencies. Like, do the people look like they actually like getting along? When I was auditioning, 2 of the residents were about to get married, and I learned that like everyone in the residency was going except for the people that had to cover on the services. But the thought that everyone in the residency was close enough to them to be invited and to make the extra effort to go really said a lot about it. So when you're looking at residencies, I would encourage you to find somewhere that the people really seem to like each other.
Thank you, Megan. That was such a
Thank
thoughtful
you.
answer. I'm hoping Mina can pop in.
I'm back. I had some technical difficulties. Sorry, what was the question?
The question Lydia wanted to know, I think, she noted that burnout is very common in residents, including family medicine residents. I think what Lydia wanted to know as a resident, how do you prevent burnout? Is that it, Lydia, pretty much?
Yes, preventing burnout and staying motivated.
Yeah.
So I think I totally agree with what I chimed in on Megan's. That was a great response. I think seeing the residency program that you're going into, so if people are looking really miserable and that they don't really get along or they're not able to get along with the attendings as well, or there seems to be a clear barrier between residents and the attendings, I think that's a red flag to look for. I also think our program, thanks to Dr. Maurer, has lifestyle medicine, and it literally teaches you how to live a better life and to avoid burnout. And the lectures are mandatory, like on a monthly basis that we get. So I think we're being kind of equipped to handle that. I also think just like anything, so there's a lot of resident wellness. So every month there's 2 activities that we do. One is the first Wednesday. We don't have a noon conference and we kind of all get together willingly to eat a free lunch, and everyone sits in the same room and we talk and we kind of go through the motions together on the hard parts of our day and the fun parts of our day. And you always hear a resident laughing in the lounge at some point. Like today I could hear it very audibly, so I went and joined them because I didn't want to be left out in the palliative room by myself. And then we also have a resident last week of every month, and we all get together off campus, and people who have to work get food brought to them, and we get $20 to spend a person and just kind of, eat a meal together and air our grievances and, kind of go through that together too. I think it's also important to state that, so when I was in the postpartum state, I did go through postpartum depression and I didn't recognize it. One of my friends, Jenna Stern, who is an incredible resident, doctor, and mom, actually recognized it in me, and asked me if I was okay and like talked me through it because she had gone through it. So I think that's really, really says a lot about the program that, another resident who I was working with every day noticed that I wasn't myself and kind of asked me those questions that I probably should have thought to ask myself, but you never do in those moments. So it was really cool to see that around me too.
Thank you so much.
I think those are super answers. Anybody else want to comment on burnout? I think it's more important what the residents say than us, but anybody else have any strategies or thoughts about burnout? I think I can only echo what they said. Having outside, like whether it's a friend or a spouse or a loved one or a colleague, I think usually you need someone else to let you know that you're headed that way. I don't think you can recognize in yourself. What do you think, Dr. Beckstead? Do you think you can recognize burnout in yourself like early enough to intervene, or do you think you need help and input?
I think it depends on the person. I've seen lots of people who identify it right away. I've seen lots of people who go way, way, way out on the edge before they
Yeah,
really see it. Yeah, it's variable. I think
yeah,
as faculty over the years, we've kind of been trained a little bit better to look for it.
yeah,
Instead of, waiting to be reactive. We try to be a little bit more proactive. That's what the whole wellness thing's about, really. Is trying
right.
to prevent it more. You don't want to treat it, you want to prevent it if you can, just like family
Yeah,
medicine.
yeah. I think that is really, I think we are so much more aware to look when somebody maybe isn't coming to conference, or somebody seems not to be laughing, or someone's getting, one of the hints is when they're way behind on their inbox. You always worry about that because, they're going home and they just are getting behind. So we do keep an eye on that. But yeah, Lydia, I would say don't fret over burnout. Just be aware of it. Because I know sometimes I read the journal articles and I've seen like the percentage of burnout residents. Both my boys want to be family doctors. And, I don't want them burned out. So I'll make them come to AFP and be residents. No, they'd be happy to come to AFP. But no, you want to really think about those things because, life is short. And yes, you want to work and do a good job, but to be that sad and not enjoying life is not where you want to be. Did we give you enough, Lydia, or any follow-up to that you need?
A lot of great ideas. Thank you so much for sharing all of the strategies.
Yeah, well,
from self-awareness to relying on others around you.
right.
I
And
think it
and if you
really
notice,
depends on that community.
there was a
Sorry.
lot of mention of, like, I always say it's like a pyramid. Make sure you're getting the sleep when you can. Make sure you're getting nutritious food. Make sure you're getting exercise. Make sure that you have at least one time a week that you're having a thoughtful conversation with someone that you love that can listen to you. I have a thing I do at orientation that kind of mentions those things, but I think you have to be self-aware, as I think Megan mentioned, so that you're making a concerted effort to make sure that you've got the ingredients in your own life that keep you kind of balanced. So thank you for that very thoughtful question, Lydia, and very important question. Any of the other students, anything you
Hi.
want to ask? Oh,
Hi,
yeah, we
I
have-
would like to add in there. My name is Jyotan Sahani. So when we talk about burnout, I think that having pets also helps a lot from being not burned out, because our daily routine becomes so monotonous. But if we have some pets or small babies in the house and spend some part of our time with them, it really helps with burnout. And I also have a question for everybody. Like, I am a non-US IMG, and I have a non-traditional path. So I'm not straight out of the med school. And so as we talked about women in medicine, I am so passionate about medicine that I could not think about anything else. But I also did a OB/GYN residency in India and was practicing there. And then later on, due to circumstances, like as destiny had it, like I got married to a person who was working here and is my husband. So with no work visa for a while, and as like what happens with international medical graduates many a times. And but my head was always towards that I have to be back into the system. I have to be a practicing doctor again. So, but I took a non-traditional path. So I started with having no visa first and being at home, taking care of my son was born here, taking care of him. And then later on, slowly, I started volunteering in the society. I wanted to learn about like how this country functions, because there is a lot of difference in how my country, India, works and how US works. So I started learning about that. I also started learning about research. I went to Mayo Clinic to do some research there and had a very good, meaningful experience there. Teaching is my passion.
Yes,
Yeah.
is there something it's wonderful to learn that all about you. Is there something that our group can answer for you?
Yeah,
Do you have a
yeah. So
question?
my question is, does your group, does your like residencies, they welcome non-traditional applicants, or do you have a cutoff year of graduation cutoffs, which are very strict and not flexible?
I will
Dr.
say
Bexton,
answers- they can definitely answer this more fully, but I did want to throw in that I have someone in my class. Her name is Danielle, and she is a grandma. She has a 8-month-old granddaughter and another one on the way. She was an accountant and homeschooled her kids and RV'd around the US for a couple years. Like, I think she meets a lot of the non-traditional boxes I would put in my mind. And she is here and happy to be here, and I'm happy to be in a class with her.
Dr. B, do you have any comments? We might want to talk to her more individually, but anything you want to share? Or
Just my quick answer would be that we have a basic guideline that you should have graduated from medical school within the past 2 years, but that's already been changing for a lot of people because of gap years and stuff like that. But that said, we always look at extenuating circumstances. So people have been practicing and have previous degrees and stuff like that. Yeah, we definitely look at the individual. So anybody potentially is on the table.
yeah, we do a holistic review. And so that would be my best answer. So I would say apply, and we do a holistic review and try to find the best people that fit that'll be happy with our residency and be happy here and grow and thrive. Any other question? Oh,
Thank you.
yes. Oh, sure. Any other questions?
Hi everyone, my name is Jyoti. I apologize ahead of time for any technical difficulties from my end. My question is, we kind of touched on this earlier, but how do you kind of shut your brain off where you don't take your patients home from work? Because I definitely have a personality where I will go home probably and be like, I wonder if I put in that work order right, or just concerned about a patient or whatever situation they are going through. So what strategies have worked for you guys to be able to manage that when you guys get home from work?
Well, I definitely want the young people to answer. I'll give you the old person answer. The old person answer is that's going to happen. Now, if it's invading all your time and you're not ever able to really be present at home, that's going to cause you stress. You have to be present in the moment that you're at. So if I have a patient I'm worried about, I'll try to address that. I'll take care of it. If I have to call them when I'm home, I will. I will write down a note to myself for the next day so I can deal with it right away. Patient safety comes first. I won't rest until I know that things are taken care of. But where you have to watch it is if you're not present in the moment to your husband or your family or your spouse or your friends, because your mind's always there. So I think that having some delineation between work and home is important, but then an understanding that as a physician, there are certain times that people's problems do come to you. And what I do is make sure, what is my plan? Do I have a plan in place? And take care of it. And if it's something like you said, did I put that order in right? I think that with humility, if I know not sure I did something right, I'll find out, or I'll get someone to help me so that I can sleep and know that it's all taken care of. But I'm curious what the younger people will say. Mina, Megan, what do you think? Because we have a first year's perspective and a fellow's perspective.
So I am that type of person. So when I started residency, I was the type of person who would call a patient at 11 o'clock at night and answer their questions. And eventually it took someone I trust a lot, Dr. Olstein, one of our other attendings, to sit down and be like, hey, what the hell are you doing? Excuse my language, but he was like, why are you doing this? What does that change? And I'm pretty sure all the attendings on here have said that to me before. And it took Dr. Olstein, because I called this patient at 11 o'clock at night because the office couldn't get through to him. The on-call doctor couldn't get through to him. And I called him, and guess what? It didn't change anything. He did not go to the hospital.
it didn't affect anything. And it took Dr. Olstein being like, so you being stressed at 11 o'clock at night while pregnant did what? And, you know, the answer was that it didn't do anything. So I think it takes a few moments like that for people that are in my type of personality to get that, you know, it didn't really change anything. And there's also colleagues that are working 24 hours a day because that's how our residency is set up. And I started leaning on my peers more and more, and that created a better relationship between me and my peers because I wasn't that crazy girl who was on at 11 o'clock at night dealing with my result that they were trying to deal with. So it created less confusion for my peers, more of a relationship of trust from me and them, and you know, a better work-life balance for what ultimately didn't change anything anyways. So if there's something that I am nervous about or I want followed up, you know, there's always someone on at night. There is always someone on weekends. There's always someone on holidays. So I started making a telephone encounter in Epic, which is just like a little encounter that doesn't exist in its own note type of thing, or a staff message. And I would send it to the person who would be there on during the day. Sometimes I would send it to the day and night person if it was the holiday, saying, hey, I'm nervous about this. Do you think you could look at this? And they always followed up. So that created, you know, a little bit more relief on my side. And they never made me feel like, you know, why did you put that on me? They were like, yeah, I'd be worried about that lab too. So thanks for trusting me. And it created that relationship. So
And Mina, now in your palliative fellowship, because you're dealing with people with very, you know, end of life issues, I'm sure this whole year, and I don't know if you can summarize fellowship directors teaching you to deal with the emotional burden of seeing other folks that are going through hard things and dying and not having at home with you all the time. Do you have any insights for the group?
Yeah, I think honestly, if you guys get to know Dr. Fabina, you'll understand when I say she is so level-headed, like the most level-headed person I've ever met. And she's able to really separate parts of her life. And I didn't really get to work with her a lot in residency just because of the way life worked. You know, we weren't precepting at the same time. We were on inpatient at different times, just how it goes. So just getting to know her and learning how to compartmentalize that. And, you know, this is that feeling I had in this room, and I'm going and doing a service to this other patient. And just like that, I'm going to do a service to my son and not bring that home with me. She's really taught me a lot already in how to leave that at work. And also there's always someone on call for palliative, and there's always someone on weekends. So to make sure we're being part of a team and trusting the other part of the team to follow up on things. And we also have a moment. So we have something called Palliative Interdisciplinary Team, and it's every Tuesday. And we kind of take a moment of silence for each death. And we kind of vent about hard situations or situations that are hitting too close to home. So my grandmother died of COVID very traumatically in my second year. And I sometimes have a hard time dealing with COVID related deaths, even though we've seen so much of it. So, you know, in times like that, I relied on my colleagues and relied on compartmentalizing different parts of my life. So I'm able to use those skills for that now too. So that's
I knew you could do a great answer, Mina. I hope that's helpful. Well, I think it's getting to be 1 minute to the hour. And I really value everybody's time. I want to just thank everybody, my faculty, my residents, all you students for coming. I hope that you look into seeing us. We're going to be at Family Medicine Educational Consortium. We'll be on the floor. We have an OMT session that's going to be helping you know how we teach people to treat people with low back pain, and we'll be teaching MDs also. We have rural medicine tracks, and I think, Megan, you have a lifestyle medicine. You want to give a blurb for your presentation, what you're going to be doing, Dr. Maurer?
Yeah, I'm doing a little talk about our interdisciplinary weight management clinic. So.
Yes, and so we will be very happy to see you at FMEC. If we don't see you in Rhode Island, come see us in Philadelphia. And we hope many of you will contact our residency. The ways to get in touch with us are either via our website, which I think if someone could throw in the chat for me, I'd appreciate it. It's www.altoonafp.org. Or you can call us at 814, that's 814-889-2030. 2020, and we'll throw that in. And we'll throw a few email addresses in the chat too, because Dr. Katoy is the cleverest little typer ever. Thank you. Yeah, we can throw in maybe my email, your email, Megan's, and let us know if we can do anything for you. We're happy to follow up with you. So if you have other questions about either the challenges of women in medicine or being a family medicine residency resident, we'd love to hear from you. So greetings, everybody. If everybody wants to just do a wave, we enjoyed seeing you. Lydia, it was good to see you again. Appreciate you coming on. Lydia's been out in Altoona, and really, we loved having her.
You should all go.
You should all go. Thank you, Lydia. We loved having her. She was a wonderful person. But and she even helped me with some advice, and it worked out. Everything you told me was excellent advice for my future daughter-in-law. So everybody have a wonderful evening, and thank you to all the faculty and residents for taking the time, and for Scott for getting things together, and the students. Good night, everyone.